Hello and welcome everyone to the second edition of the IFAD Innovation Talks, focusing today on what we are learning from behavioral approaches to measuring and delivering impact. This event is run in partnership with the UN Innovation Network, Ideas 42, and Busara Center for Behavioral Economics. Before we start, I would like to navigate you through some quick tips to help us running a smooth and enjoyable event. Please remember to keep your microphone on mute. Make use of a headset. One second, as we have some technical issues. Let me go back and check with you again on the tips. So please remember to keep your microphone on mute. Make use of a headset if possible. Close all distracting applications like I just did. Use the Q&A box to post your questions. And please remember to upvote your favorite questions in the Q&A box so that we can prioritize which questions to address first. This is a reminder that today's event is being recorded and streamed live on YouTube. By joining the event, you are agreeing to the recording taking place. Without much further ado, I would like to welcome Meike van Ginneken, IFAD's Associate Vice President of the Strategy and Knowledge Department, for the opening remarks. Meike, the floor is yours.
Thanks very much, Gladys, and nice to see so many colleagues, partners, and friends in this innovation talk. Welcome to everybody. I'm very pleased to join you once again. This is the second edition of the IFAD Innovation Talks. The first one was very interesting, and I think this one probably will be even more interesting. For those of you that join us for the first time, the IFAD Innovation Talks are a series of monthly sessions that feature innovative approaches, tools, products, and services developed by IFAD, by our partners, and by the members of the IFAD Innovation Network, in order to further the aims of this community of practice. If you like this, invite your friends to become members of this communities of practice as well, so that we really bring the collective thinking of innovation together. I'm very excited about today's topic. Today, we will be focusing on behavioral science that can help us to deliver higher impact in development projects in our organizations. The study of human behavior and its relation to economic decision-making was best analyzed in the work of Richard Thaler, who won the Nobel Prize for Economics in 2017. It's always interesting to watch people that I consider intelligent and rational human beings make decisions and act in ways that are not in line or even in exact contradiction with their objectives. I'm guilty of it myself, like we all are guilty of that. Behavior science is something that has become much more important in development in the past 10 years, when we moved away from kind of rational economic models. And I think the use of nudges to design changes to the context in which people make decisions to help them to achieve long-term goals is important. I'm far from an expert on this, and I'm really looking forward to many people in this session that are experts. I've come across it, like many of you, for instance, the nudges in behavior change, in health, in sanitation, etc. Also, for instance, doing willingness to pay studies for certain services, how different people answer vis-a-vis what they're actually willing to pay. So I've seen some of the applications of behavioral science, but I hope that people today will unwind the mystery a little bit of how we can use this more systematically and more productively. So today we'll be hearing from IFAD colleagues about how we as an organization have used behavioral science to enhance results in our projects in Mali, Peru, and India, and about how we intend to use behavioral science to drive organizational change and increase employee engagement. I'm really pleased with the people we have around our virtual table today. It's a great group of IFAD partners and leaders in behavioral science field. Welcome, a special welcome to Saugato Datta of Ideas 42, Nathanial Peterson of Busara Center of Behavioral Economics, and a special welcome to our partners in the UN Innovation Network, which is represented today by MacLennan, with whom IFAD has been working in the development of the UN Behavioral Science Report. I'm also really excited that Jo Puri is here, our director of the ECG division. Jo is a original thinker in behavioral science, but also a practitioner of how to use this. And in our bilateral discussions, we often have talked about it. But Jo, I'm looking forward to your keynote speech to put this into perspective. And I'm really happy that you're one of the driving forces towards the advancement of behavioral science in IFAD's work. So with all of this, I've raised expectations for all of our speakers. I'm sure they will live up to that. And I'm looking forward to today's dialogue and to a fruitful exchange between our panelists and our audience. So let me get out of the way for the real specialists, because they're much more interesting to listen to than I am. So back to you, Gladys, and can't wait to hear from others.
Thank you, Meike, for setting up the stage for today's conversation and for your leadership and all your support for the IFAD Innovation Talks. Now, I would like to welcome to the virtual stage Jo Puri, Director of the Environment, Climate, Gender, and Social Inclusion Division at IFAD. Jo has published in many academic journals and provided advice as a board member to several development organizations. Jo is also a co-author of Going the Last Mile, Behavioral Sciences and Investments in Climate Change Mitigation and Adaptation. Jo, the floor is yours.
Gladys, I need hosting privileges.
Of course, I forgot to do that.
So as Gladys does that, thank you very much, Gladys. Okay, so hoping my time starts now. Thank you very much, Meike, for that warm welcome. And thank you so much, Gladys, for putting this together. Really a privilege for me to be here. So as I start, let me quickly plunge into behavioral science. And Meike said this already, but I do want to make a clear distinction between what we see as behavioral science on one side and what is seen as behavioral communications, behavioral change communications, and also big incentives or interventions that come out with large monetary incentives. Behavioral science is really the science of making the choices that we want to make originally, but we can't because of many other challenges. And it's really about creating the architecture so that these choices can be made. It's about creating structures and processes so we can behave the way we want to. It's very different from large monetary incentives that essentially change the payoffs of undertaking some action. So if you give a large cash transfer, that's not behavioral science because you're changing the payoff. It's essentially doing something far more subtle, usually non-monetary, so that the payoff doesn't change, but we make the actions or do the actions that we want to originally. So behavioral science came about exactly like Meike said as well, because of Thaler's work, Tversky, Kahneman, all of these guys essentially made it really popular. But of course, in psychology, this has been there for a very long time. And in my previous work and in my current work, I started to look at this in the context of climate change. This came about primarily because we are recognizing that we have biases in our decision-making, which essentially prevent us from making the right, most evidence-based and rational decisions that we want to make. I'm not going to list all the biases, but some of these are familiar to you. We are averse to losses, and so really seeing something as a gain rather than as a omitted loss is seen very differently by us, even though it leads to the same, it should lead to the same payoff or to the same decision. How we frame a question or how we frame an action really informs our decision and will make us take very different decisions as well. That's the framing bias. In narrative biases, really, if we can put a story around it, we think that's the right explanation, rather than actually looking back and trying to figure out as to what is the real challenge or a problem in a question. Anchoring bias, confirmation bias, all of these are biases that afflict our decision-making in a day-to-day way, which then essentially means that we're not always rational or evidence-based. And so it really takes us to the space of building a choice architecture, and an architecture that will help us to do that. Most of us like to think that we are Mr. Spock in Star Trek. We are very rational. We can take decisions because we have all of the evidence. But really, we are the Homer Simpsons. We want to take decisions as easily as possible with our intuition while not wanting to put in the effort for a lot of the decision making that we do want to do on the basis of evidence and rationality. And in my day-to-day job, where I'm the director of climate, nutrition, youth, social inclusion, gender, I see this almost every day. I see the fact that science and knowledge is important, clearly it is, but it's not enough to bring about the change in action that we want to see. Obesity, drug use, smoking, alcoholism, and climate change, inaction in all these areas is just another example of where a lot of science and a lot of knowledge has been produced, but we failed to bring about the sort of actions that we think we should be seeing on the basis of this science. So let me give you a couple of examples of what behavioral science is telling us to do so that we can bring about the kind of actions that we want to see on the ground. First example is that of changing the default. This is something that's been done in Africa, where on the left-hand side, you're looking at 8 tablets that were supposed to be taken 4 at a time, twice a day for malaria. It's called artemisinin combination therapy. And essentially, because of the way the tablets were colored, people who were recipients or patients thought that the yellow colored tablets were making them more nauseous. So they would take half the tablets, sometimes forget to take some of them, and to the detriment of their health, because it created not just non-adherence, but it also meant that it made them much more immune to the parasite, or created essentially resistance amongst them. So what did scientists at DNDi come and do? They essentially came and changed it and made it 2 pills, which were white colored and then could be taken far more easily, and adherence increased. Another example is changing the norm. Changing the norm, and this was basically has been seen also in energy. In Korea, where I was previously, I would get an energy bill which would compare my energy use with that of my neighbors who are living in the same building. And that can have the impact of reducing the amount of energy bill, especially if it's higher than my neighbors. And then my third example here is on the case of doctors, and really my favorite example. And the reason I'm bringing this up is because, again, this is a very good example of where doctors who should know the disease theory actually fail at doing something very simple, which is washing their hands. Doctors know it's good to wash their hands, but they still don't. And this is because it's not easy for them to do it. This was recognized in a large study where 10,000 deaths were being essentially caused because doctors were not washing their hands. Imperial College London then combined forces with the University of Florida and put up sanitizers, or hand sanitizers, at the entrance of surgery rooms. And they found that, yes, this is useful to essentially increase sanitizing behavior, but only by 15%. So they use behavioral science insights. People change their behavior when they think they're being watched. And they put up then the pictures of men's eyes on top of these sanitizers. They also put women's eyes pictures. And then they did something else. They sprayed a lemon scent in front of surgery rooms in a third arm of the trial. What did they find? When you put just a hand sanitizer, it increases your overall hand sanitizing behavior by 15 percentage points over your comparison group. But guess what? When you put women's eyes, it increases your sanitizing behavior by 21.6%, which is 6 percentage points over and above the control group. When you put men's eyes pictures, it increases your sanitizing behavior by 33%, which is 18 percentage points over your control. So, of course, not very good for women's eyes, but c'est la vie. But the last point is really about spraying a lemon scent. Spraying a lemon scent triggers something in our brains, which makes us automatically want to sanitize our hands. And this is something that is used over and over again by soap manufacturers, but also by restaurants, and a lot by antiseptic sellers, where they will flavor or scent their products with lemon scents because it triggers something in the automatic part of our brain, in the lazy part of our brain, to think automatically about cleanliness. It's really to say that we can do many things that are easy to do to change behavior. In my second last slide, I'm essentially going to show you two study findings which focus within institutions on how we can change the impact and effectiveness of our interventions by just focusing on this overall intention-action gap. The first study was a study that my co-authors and I did where we looked at weather insurance. And we found that across the map in developing countries, although insurance companies come and assume that if they can present an actuarially fair weather insurance instrument, it will get taken up. But actually, uptake of these instruments, even after you put out knowledge for these instruments, is extremely low, and it's infamously low. Less than 25% of your target group actually takes it up. What's the big lesson? Make it easier for them to take it up, for smallholder farmers to take up weather insurance instruments. Look at the intention-action gap. And the second very quick study, very quick finding from a very different study that my colleague and I did on GCF projects was essentially also recognizing this opportunity. We found when we looked at GCF projects, more than 100 of them, the GCF projects, 82% of them did not look at this last intention action group. And it's an opportunity, not just the GCF, but also for IFAD to really improve our own effectiveness. And my last slide is we can focus then, just to summarize, on a few things internally as well as externally. Consider the use of non-monetary incentives and use them. Examine processes and incentives within an institution and change them. And I know one of my colleagues will talk about those. And last but not least, change norms, change defaults within our own processes and structures, but also within our programs and projects. Thanks very much.
Thank you so much, Jo, for that very insightful presentation. I wonder if I can use some of the examples that you were just giving us today to make my children wash their hands more frequently and wear a mask all the time when they're supposed to. Not only them, but hopefully we will be able to do some of that with people in general to overcome the pandemic. So now I am pleased to welcome our panel speakers. Juan Jose Leguía, Senior Officer at the Change Delivery and Innovation Unit at IFAD, Saugato Datta, Managing Director at Ideas 42, and Nate Peterson, Vice President for Partnerships and Business Development at the Busara Center for Behavioral Economics. Welcome. I would like to start by asking our panelists, in your experience, how can behavioral science contribute to deliver more efficient and impactful results in development interventions? Juan Jose, would you like to start?
Yeah, thank you very much, Gladys, and it's a pleasure being here. So in terms of IFAD's operational experience with behavioral science, I must say first that the UN Innovation Network behavioral report was an excellent opportunity for us to reflect and take stock on how IFAD has been affecting behaviors, not necessarily using behavioral science intentionally, maybe, as Jo was mentioning, but realizing that our investments provide ample space for the use of behavioral insights, especially on our cross-cutting topics, technology adoption, and rural finance. Perhaps the most evident case, in my view, has been our gender focus or even gender transformational projects. A great example of women empowerment, domestic violence reduction, increased local participation. It's one of our projects in India called Tejaswini in the state of Madhya Pradesh, where non-institutional spaces were created. These spaces were called Shauriya Dal, which means power groups. So these groups were providing a safe space to women to report and deal with domestic violence, but also to men through social influence norms, being sensitized to these issues. The project is considered very successful and being scaled up in IFAD and other organizations like UN Women. In Latin America, we have another very successful case in Peru of increased financial inclusion, asset ownership, also with an emphasis on women. and the use of business plan, the main BI vehicles being used are reminder prompts, channel factors, training visits by local champions, providing information on neighbors. So all of these BI vehicles being used to increase the uptake of the services. And like is already systematically trying to include behavioral science by having the support of the IDB behavioral group. They are designing specific behavioral interventions and also training the PMU staff in Ecuador and Argentina. In Mali, we also have an excellent case in Rural Finance Project, also with an emphasis in women with the use of rotating peer saving groups with a long history in Mali of a strong foundation, social cohesion. So all these experiences, methodologies, spaces that IFAD has a part of its portfolio together with upcoming UN roadmap on how to mainstream behavioral insights, I think will be the basis to develop our own BA framework and deliver more cost-effective interventions. Thank you. Over.
Thank you, Juan Jose. Saugato, I would like to now address the same question to you. When we were doing the preparatory interviews with Ideas 42, you shared some experiences and the importance for Ideas 42 of adapting and taking into consideration the context of the interventions. Can you please share some of that experience with us?
Sure. Thank you so much. And thank you, Jo, for those excellent introductory remarks. I think that really set the stage beautifully for what we think of as behavioral science and how it differs from so many other parts of what we do in development. I actually wanted to pick up briefly on the point that you made, which I think was beautifully put, that not all interventions that try to change behavior are behavioral interventions. They're not behavioral science necessarily. But I think the point that I wanted to pick up on was to say that in many of these large interventions, which might significantly change incentives, such as cash transfers, like you mentioned, there is still scope for addressing intention action gaps and these last mile challenges within those. And so I wanted to talk briefly about some work we've been doing in this area. So we've been doing a lot of work with the World Bank and with a number of country governments that has been really around trying to improve the delivery of cash in cash transfer programs. And this is how you normally think about cash transfer programs. You give people cash, there are some accompanying measures, and they lead to the outcomes you want. And what we then realize as behavioral scientists is there are so many decision action moments built into this, which actually derail this process of getting impact from the cash. So for instance, when you're getting the money, you have to make a plan to actually use it. You have to figure out what you're going to do with the money. You might have to set some cash aside for future needs. You might have to avoid temptation spending. All of these are things that, if not addressed, actually diminish the effect of a very powerful intervention like a cash transfer. And so and also on the training side, things have to be attended, followed through on, and so on. So what we've been doing with colleagues at the World Bank and with many country governments in Africa, as you see on this map, is we're looking at a variety of these kinds of programs, some of which have a focus on things like human development or early childhood, some of which have a focus on financial empowerment, but all of which have this effect of needing people to follow through in order to actually get the most out of these programs. And I'll just say quickly that this has been going on for some years now, but in Kenya, for instance, we've been working with the National Safety Net Program, and we've had very promising results from early RCTs that show that simply giving people a planning tool and a way to segregate their cash between different users actually leads to better outcomes and more saving, more investment in productive activities, and so on. And I'll skip over this Madagascar example in interest of time, very similar, but also to do with human development here. But quickly to say that, as Gladys was mentioning, we often see a lot of scope for actually user testing, and we find really interesting things that as behavioral scientists even we haven't fully come to terms with. So for instance, in Madagascar, when we were trying to do this poster that was emphasizing the importance of saving, participants in user testing told us that the people on the posters had teeth that were too regular and didn't look like them. And therefore they didn't identify with what was on the poster, and that led to a lot of changes in the design. So that's just an example. I unfortunately cannot see the time thing, so I don't know whether I'm running over, but I can stop there if we're out of time. Gladys.
Thank you so much, Saugato. Yes, that's. I apologize that we have so little time. I would like now to move to Nate to share some of the experiences from Busara Center.
So for those of you who don't know, Busara exists in Nairobi as the headquarters and works mostly across Africa, but also has a pretty large office and project set in India. I think, behavioral science has proven really appealing to people, right? They're great airplane books. People are learning about things. They're reading Thaler. They're reading, Kahneman and Tversky, System 1, System 2. And Busara especially is charged with helping people get more realistic about when and where behavioral science works, right? Because you read about these impacts and they're great. And we know that they can even be, universal or semi-universal. And so then they're read as silver bullets, right? In development, we're always looking for the most efficient way to design an intervention. And so it's really appealing when we find one that, okay, well, let's just take this from this context and move to another. And what we found, and I think what the most important part about behavioral economics and behavioral science for me is really it's a methodology of contextualizing things. So we have heuristics and biases that we know they're general. Jo shared some really wonderful ones that are fairly consistent in kind of human behavior. But one of the challenges of them is that we use them heuristically to solve problems. But what we need to do is to work in context and understand not just how a geography or the kind of income spectrum of the populations that we're studying, impact whether or not these heuristics and biases, cause and effect relationships exist. But we need to understand, the tiny things, the political aspects of their current environment, whether a pandemic is ongoing. And so I think, from the perspective of someone working in development, it's this kind of constant monitoring and contextualization that becomes really, really important to kind of maintain the realistic impacts of what behavioral science can do and how it can make our intervention designs, brilliant and simply more efficient in lots of situations. And so, I mostly work on agriculture, insurance, and uptake. And so I live in a village that's mostly surrounded by agriculture. So when I have little questions or I'm designing interventions, instead of having to design a study and go to the field, I can walk around and at least get some insights to build into my studies later.
Thank you so much for that, Nate. Actually, one of the things that I found extremely fascinating when we were doing the interviews was how important it is also for Busara to build trust in the communities, and the fact of that you actually live with the communities. You actually live in the communities where Busara is delivering the interventions. That was very inspiring. Thank you, Nate. I would like Nate to move to the next question. So behavioral economics also has applications in organizational change. So I would like to ask now our panelists, how can organizations benefit from behavioral science to drive change, increase employee engagement, and impact? Saugato, would you like to start?
Sure. Thanks, Gladys. I was having a bit of an issue with the unmuting for a second, but I wanted to talk briefly. I think that's actually an area of the application of behavioral science that is, I think, relatively new, looking within large organizations and looking for these opportunities. But I do think it's a very promising area. And I wanted to share some work that is actually still ongoing that we've been doing actually with the UN system. And this is about trying to foster successful collaboration and integration within the UN system. And I'm sure all of you, many of you are, and many in the audience are from within the UN system. And I'm sure integration is one of those terms and buzzwords that you've heard a lot, and also probably have heard a lot of people, perhaps complaining about sometimes and about the difficulty of doing it. And it seems like this really massive kind of very broad issue, right? Something like, how do we foster collaboration within the UN? But actually, when we went into this work, we realized that actually, like with many other things, you can break this sort of problem down into something which is a set of actors, a set of decisions and actions, and a set of barriers that are preventing those decisions and actions from taking place. So we did a lot of, talking to people within the UN system at various levels who have various roles in what should be seen as integrated processes. And we identified a number of ways in which there was simply sets of actors who needed to do certain kinds of things that weren't necessarily happening, and that then lead to this business of integration breaking down. So, at some point there'll be a report about this, which hopefully all of you will be able to take a look at, but these are just some examples of the kinds of people, the kinds of actions, and then the kinds of bottlenecks that arise when we're trying to think about integration. And currently we're thinking with the UN, with our colleagues at UNDP in particular, of trying to implement a couple of interventions that will actually help to resolve this problem. So hopefully there'll be a lot more work along this area, but this is just some initial work that we've started. Thank you.
Thank you so much, Saugato. That's actually how we met, right? At a presentation where you were showing some of the results from your work with our colleagues from the UN. That's really, thank you for that insightful contribution. Nate, Busara Center has also collaborated with organizations such as the Green Climate Fund. Could you share some of the experience of applying behavioral science to organizational change, please?
Sure. I think like Saugato said, we've ended up finding ourselves really focused on organizational change because we've not had the greatest experiences always having our intervention that we design implemented to the degree that we want. And you'll come with these amazing, we've used behavioral science perfectly. We've contextualized, we've done the work, we've gone with the best design teams, and we truly have new interventions, but they might contradict common practices for an agency or for the community. And because of that, we can't introduce them. And of course, what do we think? Let's go back to our toolkit, which is behavioral science, and try to use behavioral science on these organizations, which is essentially what I think, Saugato, you could disagree with me, but I think that's what most of us have come to do. Sorry, the consequence of living on a farm, I have flies around. And so I think, changing that mindset to one of openness and experimentation, and really helping organizations kind of not divest from things that have worked before, but create a little bit of emotional space between what the practices they're really tied to, interventions they're really tied to allow the experiments to actually speak for themselves and to at least try these things, right? We don't always ask that organizations just shift everything. We found the one silver bullet here magically. That rarely happens, and even when it does, we would hardly suggest that's the only implementation. But to at least come with this open mindset, and so that ends up being really our challenge. And honestly, the best way of creating this change is to bring people along for the actual research, right? And so people, I don't know about behavioral science. I'm not really sure. I feel like, I have this other expertise in agronomy or in kind of climate change. And so I don't feel safe, working in this space and designing experiments. But really, that truly is the best way to understand why we design what we design and what the insights mean that we need to have implemented. And so from the Busara perspective, and I've seen Ideas 42 do this probably initially better than we did, and we've since we're learning as well. Really begun to partner with organizations and policy decision makers to actually have them along for the ride with the research, not just presenting insights to them, and then staying along for interventions. And so that's really proven to be the most effective practice, and why I think that should become a global standard. Thank you.
Thank you so much, Nate, for that insightful and inspiring contribution. I would like to move now to Juan Jose. Juan Jose is now the project manager of IFAD's Decentralization 2.0. I'm very curious to hear, Juan Jose, how you're planning to use behavioral science to drive employee engagement and to drive a change within the organization.
Thank you very much, Gladys. So this project is still at the very nascent stage. But it aims very high in terms of transforming IFAD into a field-based institution, right? And this comes with a promise of delivering better services as a result of being closer to rural people, to our clients, but also as a result of doing things differently, both in the field, in HQ, different levels of management, senior management, middle management, in the front line. And this is about planning differently, coordinating new ways of collaboration, really, sharing different knowledge. So the behavioral challenge here, I think, is how do we engage staff in such a process when many of these changes sometimes can generate some frustration or anxiety to many of them. So I see this in three phases, and I am also benefiting from some talks with experts like Nate or Saugato. And I think that the very first phase is to build a coalition of champions and use behavioral science to attract those and develop certain behaviors in them. Then a very important is to set up spaces for feedback from staff at large, so we can understand the barriers that they are facing to engage in this process and design and apply behavioral interventions accordingly, and then get feedback, adjust, and iterate from there, right? And then a third phase, perhaps when we are in a fully fledged mode of implementation, we can select some tranches of the reform to probably assess how behavioral science or the use of behavioral insights is affecting some of the behaviors conducive to increase the likelihood of success. This would be great to draw lessons learned and apply corporate-wide, perhaps. So I hope we can use behavioral science to move forward the reform, really. Over to you.
I hope so too. I hope so too, Juanjo, and I'm looking forward to that. I would like now to shift the attention to our audience. We have, I see that we have over 200 people joining us on Zoom and many more participants on YouTube. So I would like to give now the opportunity to our audience to ask questions and invite Jo, Meike, and Mary to the virtual stage so that we can start addressing some of the questions. So I see that the question that is now being most voted is, well, Chris is asking if there is an overview document about IFAD interventions that are currently using behavioral approaches. We do have one that maybe Juan Jose can then contact Chris and share with him. So with that, I would like to move to the next question from Chitra. And Chitra is asking, this is a question for Saugato. Could you please share the full report regarding your study on UN system integration and collaboration? The Rome-based agencies are currently undertaking a joint evaluation on collaboration among the UN Rome-based agencies. Therefore, Chitra is interested in your definitions and findings. Maybe you can just share a bit of the report, and then we will make sure that we follow up with Chitra, Saugato, if you share the report with us so that we can share it with all the members of the audience.
So the report isn't finalized yet because this work is still in progress. So we would need clearance from our partners at UNDP to share it, but we will absolutely share it with you as soon as it becomes available. And and it's part of this much larger effort of the integration working group within the UN. So this is a piece of it. So they wanted to look at the behavioral aspects, but there are of course many other kinds of factors that are also being looked at. And so I anticipate the report being ready probably in the next couple of months to be shared, and we'll absolutely make sure to get that to anybody who's interested.
Thank you, Saugato. The next question is for Jo. Valentine Gandhi is thanking you for the presentation, and she says that she's curious to know, in the age of big data, where do we draw the balance between being aware of bias and eliminating selected ones and completely removing human bias or human error as an artificial intelligence or big data claims to do so? Because trial and error and bias, even unconscious serendipitous bias, is how innovations were born. Would you agree that total debiasing in decision-making, eradicating errors, or setting a strategy to bias-free artificial intelligence tools will not improve strategizing or help us to achieve desirable outcomes? Wow, okay.
Thanks, Gladys, and thanks, Valentine. Very quickly, so I think there are two things that I want to quickly perhaps clarify, and then Valentine, you and I can have a bilateral conversation about this. One, I don't think that just because we have a lot of data that we're going to debias ourselves at all. Actually, it can lead to, and it does lead to, a lot of more biases, because guess what? You have more data, you can basically mine any kind of data and use it to confirm your own biases, because we have high frequency, real time, big data, and you can essentially use it to, and actually, Nassim Taleb said this in a far more eloquent way than I'm saying it, but you can essentially use it for any theory that you have in your mind, and this essentially would lead to confirming your biases. I also think that it is important, therefore, for us to be even more aware of our biases, and this is even more true when we, now that we are in the space of fake news, for us to confront this in a far more manifest way. That is that because we have so much information, that we actually have a lot of our other biases, hindsight bias, framing bias, narrative fallacy bias, essentially coming and playing even a more salient role in the way we interpret data. And this is also true with a lot of the AI-based algorithms. And that's where I'm going to invite you for a bilateral conversation, because in the AI-based algorithms that we write, remember that we are using as trial data previous data that we have. And a lot of that trial data is really in a very different paradigm of the world. Pre-COVID, non-disrupted, at least to the extent that we've seen it. And so it can actually lead to, unfortunately, multiplying in an exponential way our biases that we see today. Sorry, Valentine, this is not striking a very positive note, but I think it's really important to be cautious. Nate's laughing.
Also, Saugato is laughing. Thank you, Jo. I would like to now address Omar Valencia's question. This is a question for everybody in the panel. Just let us know who wants to answer. In your work, in which occasions would you recommend not to use behavioral science strategies and rather go for more traditional strategies as command and control or explicit economic incentives? Who would like to address the question?
I can take a quick stab at it. I think there are a lot of, I think Nate talked about this a bit. These solutions are solutions that are targeting specific problems and a specific understanding of the context in which these problems are occurring. And I think when you do that analysis, any problem solving has to start with an analysis of what the problem is and what you're trying to solve. And when you do that, I think you will very quickly get a sense of whether this is something which is amenable to the kind of behavioral solutions that we can think of, or whether it's actually something else. And I'll give you an example from when we did a lot of work around financial inclusion in Sub-Saharan Africa and South Asia. There are certain contexts in which you might find that a certain financial product or a certain service which seems beneficial is not being utilized. And you could think that this is very much about, framing or about, many of these behavioral tools. But in some cases, it's because people simply do not have the financial resources to be able to take advantage of, let's say, a savings product, right? So that's not a situation in which you can go in with a nudge and expect people to save more if they don't have any resources. And actually, that's what drew us very much this work on cash transfers, because we said that's a situation where some of this other scarcity is being alleviated. And that's actually an opportune moment to say, how do people think about this? And can we do behavioral stuff there? So I think you have to ask those questions from the very beginning, and you will immediately see that some things are not a good fit.
Thank you so much, Saugato. I see Nate, yeah?
I was going to contribute to that just briefly. So I'm like fully in the behavioral science world, and I think there are areas that economic incentives. Busara also works pretty extensively on cash transfers and designing economic incentives. But behavioral science can almost always be used to understand them better. That doesn't mean it's always the best thing to do. So actually, there are lots of situations where the research to properly contextualize and understand something like getting farmers to take up a weather index insurance can actually be more expensive than simply just subsidizing it and enrolling them, right? And so there are lots of these things where there are trade-offs between doing the really deep behavioral science and figuring out what the intervention should look like. So that's often my role as a kind of representative of business development at Busara is to figure out when it does make the most sense to engage someone in deep research.
Thank you, Nate. I would like to move now to Thomas Kroll's question. He's asking could you share any best practices or lessons from trying to apply behavioral science into monitoring and evaluation frameworks, particularly in measuring change in attitudes and behavioral shift of program beneficiaries? And I did talk about this with Saugato. I don't know if you want to address that.
Happy to. I think Nate wants to say something as well, so please jump in. Go ahead.
Oh, sorry, Saugato, you can go first if you like.
No, go ahead.
Okay, so I think from our perspective is that there's always a trade-off between how long you can study something and what the ultimate indicator is that you want to monitor and evaluate in the first place, right? Some of those things can take a long time and be very expensive to engage, and so behavioral science can be utilized, as you mentioned, to look at like the kind of earlier stage attitude and behavior change shifts that are maybe more slight, right? But I think the important thing to remember in these types of, if you're measuring attitudes, you have to measure them more than once, because attitudes are very susceptible to small changes. And to kind of measure attitudes until they manifest in the behavior change that you were hoping to see. And again, these end up being much more cost trade-offs than anything. And time frame. We couldn't wait for a whole pandemic to elapse before we decide what to do about it, right? So attitude changes in the interim are.
Yeah, I mean, I think just to pick up on that, there's a lot of situations in which you are forced, for cost or other reasons, to really look at kind of what I would think of as more kind of proximate or intermediate outcomes. You care about something changing in the long run, but you're really not going to be able to stick around long enough to see that, and it's going to be really expensive. And so, thinking carefully about, I think having a very clear theory of change about the ways in which things influence other things, so that when you can see something at an early stage, you have some confidence, whether based on other research or based on your understanding of the particular situation, that it is going to be related to the thing you really care about. Because to go back to Nate's earlier point, there could then be situations where really figuring this out in the sort of the way you really ultimately wanting to is so expensive that it may not be worth it for the kind of change that you're going to get. So I think that's an important trade-off for everyone to consider. So we do a lot of work, I think, with looking for proximate behaviors that are easy to observe, that are things that might actually show up in some kind of administrative data, and using that as the primary thing that you measure, because that's just cheaper and easier to do. It doesn't impose a lot of additional costs on the implementer or the partner.
Thank you, Saugato. I see that Meike has her hand raised. Meike, would you like to contribute to?
Yeah, thanks very much. I think it's a fascinating discussion, and I wanted to come in on Nathaniel's point on scale, because I actually think it's really important. No, I mean, the biggest behavioral science, it's more than an experiment, campaign that I was involved in was the Swachh Bharat campaign in India, when the government of India actually nudged 650 million people to use a toilet, to wash their hands, and to go into other good hygiene behaviors. If you have a campaign for 650 million people, you can do a lot of statistically relevant research. You have the money to do this very thoroughly. And I think with, among others, Val Curtis, who passed away this year from the London School of Tropical Hygiene, it was a fascinating experiment. If I think about agriculture and the role of IFAD and translate that into IFAD, I think that some of the bigger programs we do on agriculture extension, on agricultural training, on introducing new approaches, whether it's for climate or for other reasons, I think there's real applications there. The nudging that's needed and what Jo called the last mile. I mean, we're very supply driven often, and kind of thinking, how can we create that demand? I think there's a huge amount of space there, and I think Juan mentioned a few of these examples, but I think we can do much better. It's interesting then to kind of start translating this to your own organization, no? And I think it's a real mistake to think of employees as only being driven by economic incentives. And most of the organizations we work with are not hard capitalist organizations, so we don't even give many economic incentives beyond the salary, which is a nice incentive. So I think that thinking about, with emotional intelligence, how you implement changes and nudge employees into other behaviors, etc., is very important. Is that pure behavioral science, or is that just smart and human management behavior? That's a question mark. But I think this point of scale and when is it useful to make this cost efficient is very important. And I think we do have an opportunity that we do things at scale. So let's start with those, and really also then having the data to actually do this in a scientific manner, because just doing it by gut feel, not good enough. Thank you.
Thank you, Meike. Yeah, that I won't comment on that, because I think that there is so much that could be said. That I would like to give, we only have 1 minute left, and we have many questions in the Q&A. So I would like to jump to the next question. Basundara Kanore is asking, I wanted to understand, how do you view human agency and behavior science in public policy? Is there a line where nudges could become manipulative? And Apolitical and UNDP just ran a session just on this. So So please go ahead. I don't know who wants to address this question.
Gladys, I can do it quickly, and I know Nate and Saugato and Juan Jose will come in as well. But I think where it one of the first things I said in the definition of behavioral science was something about the things that we think we want to do, yeah, which are beneficial. This is really important because it can very quickly take us into a very dangerous territory, which is that it becomes well, bad not just for us, but also for the societies that we are occupying and living in. So it is really important that not only is it good for us, but also good for society. And so using this in the interest of looking at when we are trying to build a public good, so how people work together, especially in organizations, that's why it becomes even more salient, you know, because the whole has to be greater than the sum of the parts, and we are looking at creating a public good. That's why we are thinking about behavioral science, because there's a positive to be really leveraged here. And I think that distinction is really important. One very quick other point that I wanted to make, since I have the mic, is I wanted to also say that, look, there's very good work. Ideas 42, Saugato hasn't spoken about it, but there's this lovely volume of, you know, when people are doing very, very boring things in a repeated way. And it relates to the previous question that was asked. Or when you are dealing with the temptation of corruption, for example, you can deal with, you can bring in behavioral science to then make us more productive, more honest, more efficient. And I'd really encourage all of you to take a look at that. Thanks, Anu.
Thank you, Jo. We actually have run out of time for more answers. I see that we have a lot of questions for both Nate and Saugato, and also for our colleagues at IFAD. There is one specific question that is people are curious to know whether there are reports on what the UN is doing on behavioral science. So, you know, we're lucky to have Mary here with us, and she will be elaborating on that during the closing remarks. So with that, I would just like to give time to Grecia to accommodate the background so that we can move into the next session. Thank you so much, Grecia. So I would like to now welcome Mary MacLennan. Mary leads the Behavioral Sciences Group at the UN Innovation Network, and she also led a big effort of the UN to scout for use cases of behavioral science within the UN. Mary, the floor is yours.
Great, thank you, Gladys, and thank you all to the speakers today. And this is a great discussion about behavioral science, and it really echoes a lot of the thinking we've been having across the UN system. So really, really great job. So I'll just speak very briefly about the work that I do at the UN Innovation Network, reference that report that Gladys just mentioned, and then conclude with a few remarks and some takeaways for us to go about our day with. So I work at the Innovation Network, which is it's an informal collaborative community of UN colleagues with various levels of expertise and understanding when it comes to innovation, and coming together to have discussions and to really work collaboratively across the UN. So I myself am a behavioral scientist by training, so I work only in the behavioral science space, and I run what's called the UN Behavioral Science Group. So what we aim to do is to foster behavioral science across the UN system. We're currently a collection of over 400 UN colleagues across 40 entities in 60 countries, so quite a bit of breadth and depth to what we do, and we're growing quite quickly as well. So just to give you a sense of kind of what are some of the events and the things that we do, we have events similar to this one. So it's really good to see that IFAD's doing this with some great speakers here, which promote awareness and also interest in behavioral science. And really kind of, as mentioned in the panel as well, understanding what behavioral science is, as well as maybe what behavioral science isn't, to kind of get more clarity on how to embed it into our work. We also try to increase training opportunities where we can, and then bring in outside expertise that's helpful. So we bring in academics, we bring in practitioner organization partners, so some of which are on the panel today, to really have those more detailed practical discussions. So if you're interested in the group and you're a UN colleague, it should be in the chat, the link to join if you're keen to be a part of us. our interests, the expertise of members range from just learning about behavioral sciences through to having actual experience working on projects. So no matter where you are on that spectrum, there is a place for you in the group. So just a note here about our view of behavioral science across the UN system. So as Gladys mentioned, we're working on this report. And essentially what it aims to do is to scope various levels of understanding, interest, need when it comes to behavioral science. So far, we've had 20 UN entities submit, which is quite a lot. And that ranges from entities who have full-on behavioral science scientists in capacity within their entity, which is not very many, it's only a few, but that does exist in some pockets of the UN. But most entities are really thinking at kind of the early stages of conceptualizing, thinking about ways in which they can start to embed, but also just thinking about different projects and how they can start to apply it to existing projects as well. So that's I'll leave it there. The report will come out in the next few months. Hopefully that's our intention here. There'll be more detail to be shared then, and hopefully some more connections to be made across the UN as well. Okay, so in terms of the session today, I thought it was really interesting, as I said, really echoed a lot of what we've had across the UN system. So it was really interesting to see Meike talk about how important it is to systematically and to productively think about embedding behavioral science into IFAD. I think this is something that's really interesting, and it seems like it's about the right time now to do this. So it's really this session and those remarks I think are really meaningful. Hearing from Jo about the difference of behavioral science and behavioral change, I think this is something that, again, has resonated across the UN system of how do we talk about it? What's the value add of this discipline? How is it new? How is it different? And I think some of the examples there really help to outline that, which is really useful. And like talking about choice architecture and just kind of these new terminology for many individuals, I'm sure on the call today, we'll take away some of these interesting insights. Thinking about, again, this programmatic application of behavioral science, more the traditional kind of, we started in this field almost 10 years ago, was a lot of it was on programmatic application. There's lots of interesting insights there. I won't go into all of them. I do realize we're getting close to time, but I think this again echoes across the UN system. And then almost an equal proponent, this what we're seeing across the UN as well is this interest in the management and administration, sort of institutional application of behavioral science. So really interesting to see the insights there as well. Just to highlight, not to bring in a new concept at this stage, but one thing that we're considering at the UN when it comes to institutionalizing is the idea of sledge. So really looking at the barriers that prevent people from following through with their intended actions and looking at it from a more systematic way. So there'll be a bit more work from us coming out in the next little while, building off some of the work that Saugato mentioned as well. And then lastly, this idea I wanted to bring up, which is kind of referenced throughout some of the comments, which I think is worth highlighting here, is the idea of really, we've been calling it in some of our discussions this diagnostic, this beginning stage of the behavioral science application. We often think about what behavioral science principle we're applying, why are we applying it, how we're measuring it, what's in the RCT, but really understanding the context, the individuals, taking that time. Sometimes some of the projects I run, if you have a timeline, half of it is really that understanding phase of really getting to know the population and what they need, what they don't need at the beginning, to avoid downstream issues along the line. And as mentioned too, a good use of resources and not investing time and effort in areas that may not be useful. So just some insights that I had coming through, and again, really helpful discussion. I think the colleagues on the call really enjoyed it and found it useful and meaningful. So with that, Gladys, over to you.
Thank you so much, Mary. And again, an invitation for everyone that is interested in learning more about behavioral science and the work that the UN is implementing in this sector. You are more than welcome to join Mary's team, Mary's group, and contribute to the discussion. Before we close today's event, I would like to thank all of our speakers, and very special thanks to our team behind the screens, to John Laird, Michelle Tang, Lucia Rivera, and special thanks to Grecia Bernardini Marino. Grecia is leaving IFAD this week. We will be missing her a lot, but hopefully she'll be back soon with us. I would also like to invite you to the next IFAD Innovation Talk, when we will be talking about lessons from designing and implementing innovation challenges, how to mitigate risks, and what's next. The partners for that event will be the UN Innovation Network, the Inter-American Development Bank Innovation Lab. We will have Irene Arias, the CEO of IDB Lab, delivering the keynote speech for us on that day. We are going to have also Hila Cohen from the WFP Accelerator, colleagues from the Asian Development Bank, from the ADB Venture Labs, and the president of Behavioural. So with that, I would like to thank everyone again for joining us today. Thank you and goodbye.
Thanks, Gladys. This was fantastic.
Thank you.
Thank you.
Yep, thank you.
Thanks, everyone.
Gladys, ciao.
Thank you very much.